So I'm here with Dr. Geetha Kamath. Hi, Dr. Kamath.
Hello, good evening.
How are you today?
I am doing good. How are you?
I'm doing good as well. Thank you so much for doing this interview. So I'm going to ask you a few questions about you and your experience and kind of what brought you to where you are today. How does that sound?
Sounds really good. Happy to
Okay.
share some of my experiences with you today.
Of course. So first off, what do you do here at University Health?
Here at University Health, my role is that of an Associate Professor of Internal Medicine. I am a full-time teaching faculty, which means in addition to doing my clinics, primarily in the weight management clinic in obesity medicine, I work with medical students, I work with residents and endocrine fellows who come and rotate in the clinic and learn by seeing the patients. I supervise them. In addition to that, I am the clinical director for curriculum for medical students in third year. It's called the Clinical Practice of Medicine, or CPM1, and I, with other faculty, coordinate and run these courses and conduct workshops for medical students who are getting into their clinical rotations.
Yeah. That's really cool. So when you first kind of got into medical school, was this like your first choice of what you wanted to do?
Yes, I have always wanted to work with people, help them feel better, and always was fascinated by my family physician, even as a young kid. Saw how she was able to help patients and how patients always appreciated her. So she was my first role model as a physician in India, and my parents always supported my ambitions and dreams to become a physician, and I was able to successfully get into the medical school in India and complete my medical education there.
Yeah. So was this specialty that you work in now, is this always your first choice?
I had many first choices, and since we know we can only do one specialty, in India I had trained and certified in obstetrics and gynecology, and even started my career as a full-time physician in the university in Manipal, India. And then later on, when I moved to the United States, um, I had the choice to either repeat my obstetrics and gynecology residency or do something different. Since I also loved internal medicine, I decided to explore internal medicine and did my residency in internal medicine in Chicago and completed it from West Virginia University and certified in 2005.
It's really cool. So for people that might not be familiar with internal medicine, what all do you do in the field? What all are your responsibilities?
Internal medicine is a general field of treating health problems in adults. It covers a whole host of diseases like diabetes management, hypertension, blood pressure, cholesterol, asthma, lung problems. Primary, you can work either in the inpatient setting when patients are seriously ill and admitted to the hospital where you take care of them when they are having what we call acute problems, or when they are stable and they are in the outpatient setting where patients go to their regular doctor for checkups, and that would be a primary care clinic. So during primary care visits, you might be doing routine checkups, things to screen and prevent diseases like colon cancer screening and other things, or you might be seeing them for conditions like I've had an upper respiratory tract infection or I'm having a urinary infection. Those are just a few things that the primary care physicians do. They also look into the immunizations and making sure they coordinate care with the specialists. And so there's a lot more things internal medicine physician does, but these are some of the day-to-day things you might be familiar with.
So why do you think someone should choose internal medicine?
Choosing internal medicine is very important for people who like communicating with patients, who like to advise or share and educate patients in counseling, help with preventing diseases, and helping patients make choices about their treatment and care. So it's a lot of connecting with people and collaborating with them in getting the best health outcomes in a timely fashion. Now, if somebody chooses to work in the inpatient setting, what we call a hospitalist, an internist might also be taking care of patients when they are seriously ill and need the 24-hour care in a hospital setting. So these are a couple of the different options an internist might choose to work in. Some of them work in a combination model that was more common previously. Now most of them do either inpatient or outpatient setting, as we call it.
So, how would you recommend current medical students go about choosing their specialty?
I think there's so many specialties to choose from. When medical students go through their various rotations in their third, fourth, fifth year, they will start figuring out what they can really relate to, what they can connect with, and they should also explore several other things they might overlook or not be making a decision, but which are important is deciding if this is what I want to do. Surgery might seem fascinating for a short rotation, but then is this what I want to do for a lifetime? Do I really have the passion for it? Or am I enamored by seeing the things you see on the TV shows? So that is a different decision. The long hours, the commitment, the dedication required for each field is unique, and depending on what the student enjoys, they should try to do more rotations, find mentor in fields they are choosing to explore. There are several physician educators and in the community physicians they can work with to see if this is really what they want to do, and that will help them make better choice.
That's really cool. So, you did your medical school at Kasturba Medical College in India, and then you came to the US and completed your residency and board certification in internal medicine. So, that's amazing. What do you think was the hardest part about medical school?
The hardest part about medical school is that no matter how much people tell you it's hard, what we don't realize is how much of uh, being organized, planning your day, being consistent, and prioritizing your day. That is the most important part. And at a very young age, when we start medical school and you see everybody else is taking easier courses, it might feel a little more kind of challenging. But if one has chosen this because it's their true passion, they are really wanting to do medicine, they will find that it's worth all the hard work and the struggles. But definitely takes a lot of planning, prioritizing, because we all have just 24 hours in the day. There's only so many things you can do. And when you have your exams or a difficult curriculum that you're studying, that has to take a priority, and you might have to put other things on the back burner. But it should not be self care. Self care and focusing on your current curriculum might help you make it a little easier. Also, what helps is having good social support, a good group of friends, classmates, mentors who will help you on this journey, because there are days you're going to feel overwhelmed, and when you have those days, you want to be able to talk to somebody, share it with somebody, or get the rest and good nutrition and sleep you need, and get through some of those difficult days.
It's true. Is there anything you wish you knew before coming into medical school or residency?
Medical school, most students and residents come in wanting to take care of the patient, learning about the medical diagnosis. It's fascinating to learn about how human body, the healing, caring for patients, seeing them get better is what brings most students and physicians into this field. But most of us don't realize how much of administrative component and things that are unrelated to the medical care takes a big chunk of your day, especially these days with computerized medical records and messaging system. Um, so that is the part I think the students and residents in the very beginning don't realize is also equally important in addition to learning the science of medicine. And we are doing better now in teaching and spreading the awareness. So hopefully students and residents will be able to make better choices and better equipped when they graduate and ready to start practice.
So, we've talked a little bit about your responsibilities in and outside of the hospital. You have a lot of residents and fellows that come work with you, and you are a curriculum director of the Clinical Practice of Medicine course at UMKC, and the faculty advisor of the Lifestyle Medicine Interest Group, and a co-director of Women in Medicine and Science. That's a lot of responsibilities. So how would you say you balance all these responsibilities with your busy career as a physician?
As you can see, all these different roles I play are kind of intertwined and connected and around the same theme of education and wellness. So, what I practice in my clinic, helping patients choose healthy behaviors to work through their weight loss goals, is similar to promoting wellness in the education system, in the curriculum for students, in addition to their routine medical education courses, and also in the Women in Medicine and Science. That is a chapter which tries to promote well being, healthy work life balance for women in medicine and their careers. So, all these goals are aligned and overlap in the final outcomes. So, that is what helps me stay focused and we do better in each of these activities that I do. And that is my passion. So it definitely is something I enjoy doing and has helped me continue doing it well.
That's really cool. I think something you mentioned, just women in science and kind of around that whole theme of just teaching and wellness. What are the main things people think about when choosing a specialty or even choosing to come into the medical field is work-life balance? How do you think that works for you when it comes to kind of balancing time with family and doing things outside of work?
What has helped me through the years and looking back on my experience is that the flexibility, go with the flow, and change your goals to align with your needs and meet your needs. As you can see, I started off as an OB/GYN in India. At that time, clearly, I wasn't planning to be an internist and did not have plans of moving to the United States. But when I moved to the United States, and that was a choice I made, I decided to align my goals with what would help me strike a good work life balance, given that my husband is also a physician and surgeon, and I loved internal medicine as much. So I was easily able to come to terms with switching from OBGYN to internal medicine. I did internal medicine, raised three kids, and worked in different settings. We had to move to different cities, and during this time, I also again chose to prioritize what was important to me. When my kids were little, there was a time where I had to go part time to be able to be there for their school activities. And then I returned to full time practice and back into academic medicine. Again, as the kids grew up and I realized that I wanted to address challenges of obesity and diabetes and other chronic diseases that were growing in the primary care clinic that I was seeing, I realized I could do more and offer more to my patients by training and furthering my education and certifying in obesity and lifestyle medicine. And that's what I did in the last 5 years. And that has helped me now be an expert and be able to treat my patients better using these skills. And I find the joy of reinventing myself and constantly challenging myself while adapting to the needs of our healthcare system and our patients. And I think that's what has helped me strike a work life balance. There were times when things were challenging. I was close to a burnout for various reasons, but that's when I decided to self reflect and look into how could I make this challenge into an opportunity and strive to do better and thrive instead of barely survive. And that's how I managed to find these new goals that kept me going.
That's really inspiring. I think it's important that a lot of students now kind of follow that ideology of finding what makes them passionate about medicine. So that's really cool. So you're also a co-author of a new book that was recently published called How Healers Heal, and it's about lifestyle medicine physicians. So can you tell me a little bit about that? What is it about, and what inspired you to write it?
So, Lifestyle How Healers Heal is a book by 33 physicians who are board certified in lifestyle medicine and also specialists in different fields of medicine who have tried to motivate and inspire other physicians and patients into seeing this relevance, significance, and importance of healthy behaviors, lifestyle, in addition to just medications and procedures and pills for chronic disease management, which has become a big challenge in our society, not just nationally but globally. The challenges of diabetes on the rise, the obesity, hypertension, COPD, cancers, these are all not contagious diseases, but as you can see, these are related to our lifestyles, poor eating habits, too much stress, lack of sleep, inadequate exercise. And this is not just advice, but many a times the challenge is how to translate from knowledge to action. Needs a lot of support, a lot of understanding, and a lot of science behind it, because there's a lot of confusion around nutrition and what is too much, what is right, what is wrong. So when you are certified, you train in these fields, and you're able to help your patients using these skills and also use it in your own lives, you really find that you can have long-term sustainable health benefits. And that's what this book is about. Each of the authors have described their personal journeys, what led them into certifying and training in lifestyle medicine, and how they are currently using it in each of their practices in different specialties. Be it an oncologist using it in treating their cancer patients, be it an endocrinologist for diabetic patients. I am working in the obesity weight management clinic using it in my goals to help patients achieve their weight loss and regain their health benefits. So, this hopefully is an inspiring book for medical students, residents, other physicians, and even patients. It is written in simple uh, terms and simple language that everybody would be able to understand. And hopefully, this will help people follow those lifestyle behaviors and thrive in their own lives.
That's really cool. So I know we've kind of had like a theme among this interview of like wellness and self-care. So do you have any last minute tips or advice for the medical students or pre-medical students watching this?
Sure. Medical students and pre-medical students are an amazing young generation of people with a passion to serve others, take care of others. They have chosen these paths or wanting to choose these paths because they want to do this. And I would recommend to anybody who's doing this, it is a lot of commitment. It's a lot of many years of dedication to the science. So be prepared for the long run and long haul. And if you're really interested and want to do this, then be ready to take on. There is no shortcuts in medicine. Being consistent, being organized goes a long ways. At the same time, prioritizing, like I said, we don't want people to give up on their sleep, their social interactions with their family, and such other activities, because that's what helps you do the best in both your medical education and personal life. Although it's hard in the initial days of training because you are trying to figure out a lot of things, it does get easier as you go along and as you become more experienced in this field. It takes a lifetime of dedication and being organized, however. That is one thing that will keep you going in this field.
Amazing. Well, Dr. Kamath, that's all I have. Thank you so much for your time today.
Thank you again, and all the best to everybody who is out there trying to get into medicine or already training. Consistency, diligence, and having faith and passion is what will keep you going. Some of the best friendships are formed during your most challenging years of studying together, and you will find it rewarding in the long run. All the best.